Tuberculosis, or TB as it's commonly called, is an infectious bacterial disease characterized by the growth of nodules in the tissues, especially the lungs. It is one of the most deadly diseases that is caused by a single bacterium, even though the vast majority of its cases is treatable and curable. The problem is particularly severe in third world countries where insufficient diagnosis and treatment means that a large fraction of infected people end up dying.
TB can occur almost anywhere in the body. For example, bone TB, which causes skeletal malformations, was very common when the pathogen first developed. Primary symptoms of tuberculosis include weight loss, night sweats, fever, and coughing up blood. However, many people infected with the bacteria are carriers and don't show any symptoms. This is one of the particularly dangerous aspects of the disease because TB spreads by airborne respiratory droplets via coughs or sneezes.
TB is the oldest recorded disease. Archaeologists have even dated it back to ancient Egyptians after spinal tuberculosis was found on many of the mummies. In the 18th and 19th centuries, there was an epidemic of TB in Europe and North America. However, TB was not officially diagnosed and given a name until 1882 when Robert Koch, a German doctor and scientist, decided to study Mycobacterium tuberculosis, the bacterium that causes TB. After Koch discovered it and gave it the name of tuberculosis, people began to refer to it as the white plague because the skin affected individuals becomes extremely pale.
Tuberculosis has been around for quite a long time, but where did the pathogen come from? It is thought that the bacterium Mycobacterium, which is a subdivision of the bacteria Actinobacteria that has 150 recognized strains, originated in the soil. Scientists believe that Mycobacterium then evolved into Mycobacterium bovis, a disease that gives animals TB-like symptoms. When humans started raising livestock, Mycobacterium bovis mutated into a strain that could infect humans, which is Mycobacterium tuberculosis.
Currently, the number of cases in the United States is fewer than 200,000 annually, with less than 5% of those cases ending in death. Although the global rate of death from TB has dropped significantly over the last 2 decades, and it is considered rare in first world countries around the world, there is an estimated 9.6 million new cases of TB every year, approximately 26,000 new cases every day. In third world countries, many cases are undetected and untreated, resulting in death rates approximately 50%. For those that are treated with the proper medication, the death rate is approximately 20%.
There are a number of factors that contribute to the continuing problem of TB, especially in third world countries. First, there is the fact that asymptomatic carriers of the disease unknowingly spread it. Up to 1/3 of the world are carriers for the bacteria, but only 5 to 10% develop symptoms of TB. Those that develop active TB tend to already have poor habits, such as the use of tobacco, and poor health, including malnutrition, diabetes, and HIV, which can partially explain the large amounts of people in third world countries that have TB. Second, there is a lack of awareness that the disease is still widespread, in part because many cases are not diagnosed, treated, or reported. TB is partially preventable with vaccines, but many people in third world countries cannot afford vaccines for children and adults alike. In third world countries, treatment of drug-resistant TB is particularly difficult for people who are struggling financially, such as those that need to care for children but can't afford to stay in hospitals for a long time. These patients get sick from TB, but continue to go to work because of financial difficulties, thus spreading the disease to more people. After being so sick that they cannot work anymore, they stay home since they cannot afford to go to the hospital. As the patients die slowly in the house, the caretakers, usually family, also get infected with TB, and this vicious cycle continues. Even if a patient is able to go to a hospital, as discussed above, drug-resistant TB is more difficult to treat.
Third, those who are sick with TB but don't report their illness tend to be the most vulnerable, including women, children, the very poor and malnourished, prisoners, minors, indigenous populations, and the elderly. In some areas, there's simply no access to medical care. Of particular concern are those people who are suffering from HIV, since HIV and TB are a particularly deadly combination. As either of these diseases worsens, one fuels the progression of the other in the infected person. Indeed, TB is the leading killer of people living with HIV, with 1 in 4 HIV patients dying of TB. Finally, contributing to the rise of TB is the prevalence of drug-resistant TB. One reason this happens is that TB patients often stop their antibiotic treatment before it is completed. With the bacteria not completely killed off in the body, the bacteria often mutates. This causes drug-resistant TB bacteria that are immune to the antibiotics used to develop. As of 2015, there are approximately 480,000 cases of drug-resistant TB each year. In the next 3 decades, drug-resistant strains of bacteria could drive up TB death rates by over 2.4 million per year. Drug-resistant TB is much harder to treat, typically requiring 2 years of medication and hospitalization for the first months of treatment. Consequently, the cost of treatment can be 200 times the cost of treatment for normal TB, as drug-resistant TB responds to even fewer available medicines.
In 2012, the FDA approved bedaquiline and delamanid as treatments for TB. Both drugs have been proven to effectively treat multiple strains of drug-resistant TB. However, these two drugs are still not widely used to the fear of creating even more strains of drug-resistant TB. Critics claim that this is protecting the drugs, but not the people. Despite this criticism, health officials remain cautious about putting new drugs out in fear of dangerous and unexpected side effects. According to Dr. Erdahl from University of Washington, a vaccine is what we really need since
behind the vaccines is that you would prevent the disease from getting to the point where it would even
need antibiotics.
Right.
The problem with TB is that you need to treat for 6 months at least. And for all drugs that are, for bacteria that are drug resistant, you have to treat longer, 12 months or longer. And these drugs are pretty nasty. They make you feel sick. And if you take it for 2 weeks, you probably feel a lot better. And so are you going to continue to take these horrible, 10 pills a day that make you feel sick? If you feel much better after taking it for 2 weeks, and if you take it suboptimal, if you don't take the full medicine every day, then you're going to develop resistance to those antibiotics.
The greatest issues with TB are in less developed countries, such as India, where previous numbers woefully understated the true numbers of cases, and the World Health Organization estimates that almost half of the estimated 2.8 million cases are never reported to health authorities. In this sense, TB is much like a hidden disease. Without the numbers and data needed to raise alarms in government officials, there is insufficient awareness that it is still a disease that plagues the poor.
In Kenya, for example, TB remains a major cause of morbidity and mortality, where it primarily affects people between 15 and 44 years old, especially women. Some of the factors that contribute to the spread of TB in Kenya are the HIV epidemic, poverty, social deprivation, the growing number of slums, congestion in prisons, and limited access to general health services. Nonetheless, the government and Ministry of Health in Kenya have been working hard in recent decades to improve treatment of TB and to reduce its incidence, and the number of important steps are being taken. For example, efforts are being made to improve coordination among the providers of health care and integrate patient care of TB prevention. Secondly, they're trying to decentralize TB control services down to a community level. Once the implementation of TB control is in the hands of local providers, it will be possible for treatments to be administered more effectively. Third, since TB and HIV are both widespread and are risk factors for each other, the Health Ministry proposes to improve the coordination between TB and HIV control services.
Despite how horrendous TB is, progress is being made. The mortality rate for TB fell by 47% between 1990 and 2015, and effective diagnosis and treatment have saved about 43% of TB patients. The planet's primary hope of someday eradicating tuberculosis rests with the United States and other first world countries, where cases of TB are controlled, contained, and treated effectively. A particular source of hope is the work in groups such as the Bill and Melinda Gates Foundation are doing. Research and development is underway to create more effective vaccines and develop new drugs and technologies for diagnosis. Scientists and doctors are working to get drug-resistant TB under control. With continued investments in health systems around the world, the dream of eradication of TB remains possible.